Most of you have no doubt read and heard a lot about the Massachusetts health insurance law passed in 2006. It requires most adults to have insurance coverage. About 98% of residents now do. And it became the template for the Affordable Care Act. You probably heard it called Romney Care during last year's campaign, much to its namesake's chagrin. Our former governor helped craft the bill and signed it into law. So there he is signing it into law. What you may not know is that Governor Romney's successor has largely overseen implementation of the law. And Governor Deval Patrick, our speaker tonight, has also taken steps to slow the perpetual growth in health costs. Among them is another Massachusetts first, putting the state's healthcare industry on a budget by setting a goal for health spending to rise no faster than the rate of growth of the overall state economy. The governor is so proud of that legislation that his staff asked me to show the picture of him signing the bill last August. They also have been quietly testing a new name for the Massachusetts healthcare law in focus groups, a name they've given us permission to unveil today. For those of you who just tweeted that, I'm kidding. Seriously, Governor Patrick grew up on the south side of Chicago, but had the good fortune to win a scholarship to a prestigious private high school in Massachusetts through a Boston-based charity called The Better Chance. That led, after a few years, to admission to Harvard College. He was the first in his family to go to college, and then Harvard Law School. After working as a lawyer and executive for companies like Texaco and Coca-Cola, he was appointed Assistant Attorney General for Civil Rights by President Clinton, the nation's top civil rights post. He then returned to Massachusetts and was elected governor in 2006 and is now serving his second term. It is my pleasure to introduce Governor Deval Patrick.
Thank you very much, Gideon, for the warm and funny welcome. He was about to, when I actually saw the first picture go up, I thought, how do I smoothly ask him to remove it while I speak? I saw the second picture, and it seemed a little strict. No, actually, that you can leave. Thanks, Glenn. I'm glad to be with you all, and I welcome everyone to Massachusetts. We're delighted you're here. I'm thrilled with the record attendance. I'm a little concerned about the time of day when I was asked to come by, because I have a sense I'm between you and your cocktail. So I'm going to keep my remarks brief, and then I understand we'll take a few questions or comments or advice. And if you are like journalists locally, it'll be mostly in the form of comments and advice. You are in the right place at the right time for a discussion on healthcare reform. Throughout my time in office, healthcare has been a central issue that we've been working on, as you heard Gideon describe it, how to expand access, how to improve quality, how to control costs. I don't think this is surprising. In one form or another, healthcare affects everything. Government, business, household budgets, people's ability to get a job, a child's readiness to learn. Given the significance of healthcare to so many aspects of our lives, I think we have been right to pay attention to these issues. And 6 years in, let me give you my perspective on where we are and where we're going. By any measure, I think, healthcare reform in Massachusetts has been a success. Today, we have virtually universal coverage, as you heard Gideon describe. I don't think any other state in America can touch our levels of insured citizens now, residents today. More businesses offer healthcare to their employees today than before healthcare reform took effect. That was a big concern at the time, so-called crowd out. In fact, 76% of Massachusetts businesses who today insure their employees, far more than before 2006, and well above the national average. Over 90% of our residents primary care physician, and 4 out of 5 have seen their primary care physician in the last 12 months. Preventive care is up. More people are receiving cancer screenings, more women are getting prenatal care, and visits to emergency rooms have decreased. 150,000 people have stopped smoking because we expanded coverage for smoking cessation programs, and we are healthier because of it. Women, minorities, and low-income people have experienced the biggest health improvements, but it's been true really across the board. For example, among Hispanic males, a notably underinsured population in Massachusetts before health care reform, the detection of testicular cancer has more than doubled, and the majority of cases are now detected at an early treatable stage. With increased access to screenings, we've seen a 36% decrease in cervical cancer in women. By the way, expanding coverage added only about 1% more of state spending to our budget. Those are the stats. Even better are the stories. I have met young women and men from all across the Commonwealth who had their cancers detected and treated, their lives saved, really, because for the first time in their lives, they've had access to affordable care. I met a young entrepreneur who told me about moving his business here from Florida because he wanted to be in a place with a young family where he could be assured of health care during the early lean years of that business. Policy, in my view, matters only where it touches people. It's abstractly interesting in the abstract, but it matters when it touches people. And because healthcare reform in Massachusetts touches people in such positive ways, it's been a great success. And I think that's why, by the way, it continues to poll very positively among our residents. I forget what the latest numbers are. You probably remember, Gideon. But it's remarkable. During the campaign, during the president's campaign for re-election, I was struck by how the Affordable Care Act polled in Massachusetts about 50-50. Healthcare reform in Massachusetts polls in the 70 and 80% approval. They're the same thing. They're the same thing. I think as important as the policy for us has been the values that underlie healthcare reform here and the means by which we have accomplished these results are equally so. For us, health is a public good, and we believe everyone deserves access to affordable quality care. We see access as an expression of the kind of commonwealth we want to live in and the kind of community that we are. That value was meaningful enough in 2006 to compel a Republican governor, a Democratic United States senator, a Democratic legislature to work together with organized labor, with business groups, with medical professionals and patient advocates to invent healthcare reform. And here's the critical part. And then they stuck together to implement it. They stuck together to implement it. And I think that's especially important because they realized that this was too big an undertaking to simply pass legislation and then expect that things would work on automatic pilot. That approach has been just as important in crafting and now implementing the next big chapter in healthcare reform in Massachusetts. The second picture you saw there, not exactly, but represented there, and that's cost containment. Last August, I signed legislation that takes this next big step, and that bill makes the link many have long recognized between better health and lower costs. So we are moving away now from a sick care system to a true health care system, away from fee-for-service care to paying for health outcomes and quality of care. Through a series of tools ranging from enabling new care delivery models to capping the rate of overall cost growth to medical malpractice reform, our new law will result in nearly $200 billion in healthcare cost savings over the next 15 years. I am confident that just as we showed the nation how to deliver universal care, Massachusetts will be the place that cracks the code on cost containment, and I'm really excited about that. We're working now on implementing the Affordable Care Act. It will take time and care and thoughtfulness, and there will undoubtedly be hiccups and challenges along the way. But we will come back to our core principles, that health is a public good, and that all Americans deserve access to quality, affordable care. And we remember that the success of the ACA depends on the same formula that has made Massachusetts health reform successful. That is the important, and that is that we do this important delighted you're